I'm Dr. Sarah Watley, and today we're going to be talking about heartburn versus heart attacks. As I film this video, we are headed into the holiday season, and many things happen during the holidays, one of which is that we change some of our regular habits, and in addition, emergency room visits increase. There's actually a 12 to 33% increase in emergency room visits during the holidays. The second most common complaint for these emergency room visits is chest pain. So today we're going to talk about two common causes for chest pain: heartburn and heart attacks. Sometimes during the holidays, we change up some of our habits, like eating healthy, whether it's multiple holiday parties that we're going to, or we're feeling a little festive, so we abandon these healthy habits and introduce foods that we maybe normally wouldn't eat that might show up as certain symptoms in our body. In addition, alcohol consumption also goes up during the holidays, which, in case anyone has not told you before, increased consumption of alcohol is not good for you. While I love the holidays and the joy and the gathering together that it brings, this can also introduce some stress, whether that's preparing for people to be in your home, or work-related stressors, family issues, or even financial strains. Either way, stress will have an impact on your body. In addition, during the holidays, sometimes people stop taking their regular medications, whether this is due to travel or forgetting or just being out of our regular routine. If you are taking daily medications, I do not recommend that you abruptly stop these medications without working closely with your doctor. So we've established that during the holidays, some of our regular healthy habits can change. So let's look at how that might contribute to some symptoms in our body. Heartburn can also be referred to as acid reflux or indigestion or GERD, and we can use these interchangeably. So what is heartburn? Heartburn is when acid that's in our stomach backs up into our esophagus. Our esophagus is our tube that goes from our mouth to our stomach, and that's how we get food and drinks into our stomach. Now, once the food and drinks are in the stomach, there's a little sphincter, like a door that opens and closes, that allows the food to go in. We do not want the food or the acid to come back up, but sometimes that happens. And it can happen for various reasons. One reason can be overeating. For example, at the holiday table, and we eat so much it overexpands our stomach. The other reason can be eating foods or drinks that increase acid. And the most common ones would be alcohol, caffeine, or carbonated beverages. Foods would be spicy, greasy, fried foods, or a lot of citrus, which is very acidic. In addition, smoking can also increase acid. So once that acid is backing up into our esophagus, that can cause a lot of pain or heartburn. This gives you the symptom of burning in your chest, or sometimes it feels like tightness or squeezing, and can even make it feel like you're short of breath or you're having a hard time breathing. So if you're sitting here at the dinner table, you know you've had a big meal, you had a lot of food and drinks that increase acid, and you're just totally uncomfortable. I recommend doing a little home remedy that might be able to help you quickly. Now, with this said, if you're feeling totally stable, you know this is probably acid reflux, then try this remedy. If at any point you feel not stable, you don't feel good, or you have a sense that something is very wrong, please go to the emergency room. Now, if you think that it's acid reflux and you're having a lot of indigestion, I recommend that you get a half a tablespoon of baking soda and mix it in 4 ounces of water. You take this elixir and swallow it down. It may not taste super great, but within 10 to 20 minutes, that baking soda is going to help neutralize the acid in your stomach, and you are going to feel a lot better. If you're still not feeling well or anything else changes, definitely call your doctor or go to the emergency room. Next, we're going to talk about heart attacks. So, what is a heart attack? In the medical field, we also call this a myocardial infarction, which is kind of funny to say. But basically what this is referring to is death of the muscle tissue of your heart. In your heart, we have two systems. We have the plumbing and we have the electrical. With the plumbing system, this is your blood flow. So we need blood flow to that heart tissue so that it will work and pump the right way. When we have a decrease of blood flow or a complete blockage of blood flow to the heart, then that is when we can have a heart attack. So what does a heart attack feel like? First, let me say that there are many things in our lifestyle leading up to the moment before we have a heart attack. And this has a lot to do with lifestyle, how we're eating, how we're moving our body, managing stress, how much alcohol we drink, if we are smoking, and then also genetics. So prevention is always key. But if we are, again, at that holiday dinner table and we are feeling a little bit uncomfortable, I want you to know the signs and symptoms of a heart attack so we can take this seriously. So number one, you can feel chest pain. This may feel like tightness or pressure. The pain might sometimes go to the back, or you might get pain or numbness to your jaw or down your left arm. You might also feel short of breath, like it's hard to take in a deep breath. You may also feel cold sweats, feel very tired, or even feel dizzy. If any of these things are happening, listen to your body and take it seriously. And please go to the emergency room for evaluation. In the emergency room, the doctor can do an EKG. This is a non-invasive test that is very quick and can give us a lot of information. This can tell us right away if you are having a heart attack. If the EKG is normal, there is also some blood work and other testing that can be done in the emergency room to tell us if there's an issue with the heart. That way we can intervene right away. Time is of the essence because we want that blood flow getting back to that heart tissue as soon as possible. So we've talked a lot today about symptoms of chest pain and different causes of that for the holidays. And what you might have cued in on is that symptoms of heartburn and symptoms of a heart attack can be very similar. They can both cause some chest pain. They can also cause maybe a feeling of difficulty breathing and even nausea. So if you are not sure, please go to the ER. The most important thing is prevention. So if you've identified a few things that you might be able to tweak before the holidays or keep on track with those healthy habits, that's the best thing in preventing a flare of indigestion or triggering a heart attack during the holidays. So try to drink lots of water, eating lots of fiber in your diet, staying active, and managing stress. If you have any questions or concerns, please reach out to your doctor or reach out to me if I am your doctor. And if you want me to be your doctor, please check out my website at drsarahwatley.com. If you enjoyed this video, please like it, leave a comment or your questions below, and subscribe to my channel so you can see more useful videos in the future. I hope you have a wonderful and healthy holiday. Thank you so much for listening.